Welcome back, everyone. Here in the Texas Panhandle, we're always looking for ways to support families and ensure moms and babies get the very best care, especially during those high-risk pregnancies. I'm excited to introduce you to Dr. Shaun Wesley. He is a new maternal fetal medicine specialist who has joined the community. We'll talk about what that is in just a minute. But for you, Dr. Wesley, this is kind of a homecoming.
Yes.
Let's talk about that. You grew up here.
I did. I was born and raised in Amarillo, and then I grew up in Canyon. I went to school at West Texas A&M. I did my training at Texas Tech for medical school and for residency, and then I went off to the Northeast, and I trained at the University of Rochester in New York.
What's it like to be home?
It's great to be home.
Yeah.
I have a wife and 4 kids, and being so far from home over in fellowship training was just a little bit tough on them, but being back has been great.
Let's talk about, because it's great to have you, but what you do specifically is so important about having that right here on the high plains. Let's talk about that.
Absolutely. So a lot of people's first question is, what is maternal fetal medicine? So it is just a specialty that helps people where the mom or the baby has something that kind of creeps up on them. Maybe the mom has diabetes or high blood pressure, or they find something on the ultrasound that the baby has. And so that having that ability to get that seen and looked at here in the Texas Panhandle without having to drive to Lubbock or Dallas or even Oklahoma sometimes has been great for our patients.
How lucky are we that you decided to come back home? Indeed, what kind of moms might need that assistance? You know, you kind of talked about like diabetes. What other options are there?
If they have high blood pressure, if I handle moms like maybe the mom has cancer, maybe they have a certain conditions, maybe they've had surgery or major kind of pelvic surgery or abdominal surgery that they want to see a specialist to see how does that affect my pregnancy?
Man. This is such a big get for the area. You talked about driving before you got here.
Right.
If anybody needed this kind of care, they had to take a road trip. They had to get out.
Absolutely. They had to go all the way either to Lubbock. We had some colleagues in Lubbock, or sometimes because they didn't have those specialties there, they may have to go to Dallas, or they may have to go out of state to Oklahoma.
So what kind of technology or services are you excited to bring to Amarillo?
Oh, I'm very excited that we have an ultrasound suite at Texas Tech on the 3rd floor. So we bring high-risk ultrasound and advanced ultrasound technologies like fetal echocardiograms, which is an ultrasound of the baby's heart. We also bring genetic counseling. So sometimes there's abnormal genetics that happen with our baby, and so we talk about what does that mean for us, what do we need to do those diagnoses, and then I do a lot of collaboration between the subspecialists here in town like the NICU or the pediatric cardiologist. Dr.
Wesley, we are lucky that we got you. We're glad that you're back home. And if anybody wants any more information on the services that you provide, how can they reach out to you?
Oh, that's a great question. So if you think that you have a problem, or if your doctor thinks that they need help, you can reach out to us. We're on our website at Texas Tech Physicians, where you can ask for maternal fetal medicine. Your doctor can do a referral to our front desk, and then we're able to get them in and see them.
Well, kudos to the Texas Tech University Health Science Center for getting this score for our area. It is a big win. Dr. Wesley, glad to have you. And we do have more Studio 4 coming up after this.